So look at that. In rural America, the maternal death rate is almost twice as high as in more populated urban areas. Again, it's a huge problem. And listen, the government has known this for a long time, and way back in the 1970s, they actually created what's called a rural health clinic, an RHC designation, to increase reimbursement to rural physicians to try to get more physicians to practice in rural America and get greater access to healthcare services for people living in rural America. Okay, so what does that increased reimbursement look like? Well, there's some specific things that the practice has to do. Interestingly, it has to use nurse practitioners and physicians associates. It has to use what are called these advanced practice providers, or APPs, as sort of like force multipliers. So if you have a doc in that particular area, then you have additional clinicians that can see more patients as well, which is, again, super helpful in terms of having greater access to care for people in rural America. And then also the clinic has to have access to laboratory services. They could have to do phlebotomy to draw blood there, because you don't want to have somebody come into the clinic and then have to send them for an hour or 2-hour car ride to get their blood drawn. So there are the additional things you have to get the higher reimbursement as an RHC designated practice. And it's a lot of money. So in 2025, these RHC practices get $152 per visit, which is a lot. And it's scheduled to increase to $165 per visit. And they've already set out a schedule of further increases in subsequent years. This is at a time when many physicians are actually seeing decreasing reimbursement from the government and insurance carriers. And here you have an area where there's actually increasing reimbursement for physicians from the federal government.